Did you know that your body might be warning you about a stroke week before it happens? Strokes strike fast, but the signs can be slow and subtle. In this video, we'll uncover 7 early symptoms that could save your life or the life of someone you love. Recognizing these signs just might be the key to preventing a devastating stroke. Stay tuned because what you learn today could be a game changer. If you experience any of the signs I'm about to share, seek medical attention immediately, as they could indicate that a stroke is imminent. Delaying diagnosis increases the risk of significant brain damage. Symptom 1. Excessive fatigue. Excessive fatigue, or extreme tiredness, can be a symptom or a warning sign before a stroke. It's important to remember that fatigue can also have other causes. However, if you're experiencing intense, persistent tiredness that is atypical for you and not related to physical exertion or a lack of sleep, it could be an alarm. This excessive tiredness may be related to changes in blood flow to the brain due to narrowing of an artery or a possible clot, which interferes with the supply of oxygen. If you're feeling an abnormal level of tiredness, seek medical attention immediately. Symptom 2. Persistently elevated blood pressure. Persistently high blood pressure, or chronic hypertension, plays a crucial role in increasing the risk of stroke. If left uncontrolled, hypertension can lead to serious health issues. Blood pressure measures the force of blood against the walls of your arteries. When this pressure rises, it can severely damage blood vessels, causing them to narrow, weaken, or even rupture over time. This damage significantly elevates the risk of a stroke. If a blood vessel in the brain bursts due to high blood pressure, it can result in a hemorrhagic stroke. Alternatively, if hypertension damages the arteries that supply blood to the brain, it can decrease blood flow or cause a blockage, leading to an ischemic stroke. Therefore, it's essential to manage hypertension effectively. Adopting a healthier lifestyle and following prescribed medication regimens are critical steps to lower the risk of stroke and other cardiovascular diseases. Symptom 3. Vision problems. If you experience any sudden changes in vision, it can be a warning sign. Blurry vision, double vision, eye problems, or difficulty focusing can signal circulatory damage in the brain and serve as warning signs of a stroke. While there are various causes for vision problems, it's crucial not to overlook these symptoms. Vision loss may result from the blockage of an artery supplying blood to the eye, often indicating an ischemic stroke, the most common stroke type. Take such changes seriously and seek medical evaluation promptly. Symptom 4. Numbness or weakness in body extremities. Numbness or weakness in the extremities, especially on one side of the body, can be a warning sign before a stroke. This sudden numbness or weakness typically affects a single body part, like an arm, leg, or one side of the face, leading to decreased sensitivity. Although these symptoms often last for just a few minutes to a few hours, they should never be overlooked. Regardless of whether they signal a stroke or another neurological issue, immediate medical investigation is essential. Symptom 5. Sudden and severe headaches. A sudden and severe headache can be an early warning sign of a stroke, but it's important to remember that not all headaches are linked to strokes, and not all strokes are preceded by a headache. In the case of an ischemic stroke, a headache may occur due to a blockage in the brain's blood flow. These headaches are often described as severe and sudden. In a hemorrhagic stroke, where there is bleeding within the brain, intense headaches arise from the increased intracranial pressure caused by the bleeding. Witnesses of such events often observe the person clutching their head in intense pain, sometimes followed by a loss of consciousness. This is particularly common in hemorrhagic strokes, where the headache is frequently described as the most severe the person has ever experienced. Additionally, a severe headache might signal an imminent risk of an aneurysm rupture in the brain. Symptom 6. Speech problems. A person about to have a stroke may suddenly have difficulty speaking. This can manifest as slurred speech, challenges in articulating words, or forming complete sentences. Such difficulties are categorized under aphasia, defined as the impairment in understanding, formulating, and expressing speech. Symptom 7. Neurological problems. Individuals on the brink of a stroke, whether it be hemorrhagic or ischemic, may exhibit a variety of neurological symptoms. These can include memory issues, loss of balance, as well as nausea and vomiting. These symptoms may manifest a few days or even weeks before a cerebral event. It's crucial to remember, however, that various other conditions can present similar symptoms, complicating the diagnostic process. Conditions such as migraines, seizures, hypoglycemia, brain tumors, anxiety attacks, and infections in the central nervous system can all elicit these symptoms. It is imperative to consult a qualified doctor for a comprehensive evaluation to accurately determine the cause of these symptoms. Do you have a history of stroke in your family? The risk of having a stroke is elevated in individuals who have a family history of stroke. Having a first-degree relative, such as a parent or sibling, who has had a stroke increases your own risk of having a stroke in the future. Stroke is caused by a combination of genetic and environmental factors, and a family history of stroke may indicate a genetic predisposition to stroke risk factors such as high blood pressure, high cholesterol, and diabetes. Therefore, if you have a history of stroke in your family, it is important to take preventive measures, such as maintaining a healthy lifestyle, controlling blood pressure and cholesterol levels, and managing diabetes if you have it. It is also important to consult a doctor for regular checkups and follow any recommended tests and treatments to minimize the risk of a stroke. Remember that stroke is a serious condition that can cause permanent damage to the brain or even be fatal, so it is important to take preventive measures as soon as possible. So it was all about my today's video. Thank you so much for watching. A like is always appreciated, and remember to subscribe and tap the bell for more videos.